Kuzuzampo, welcome to Bhutan This Week, our weekly news magazine program with me, Sunampem. Our top stories this week. The first consignment of COVID vaccine arrives in the country. The Wangdefoda District Hospital to provide cancer-related surgeries. And the Election Commission prepares for the third Thomde elections. Now the details. The country received the first consignment of COVID-19 vaccine from India. 150,000 doses of Covishield vaccine is a gift from India. And Bhutan becomes the first country to receive the vaccine just 4 days after India's massive rollout.
It is around 3:25 p.m. when an aircraft of the Indian Air Force lands at the Paro airport. A sigh of relief as it touches down the runway. It is one of the most important consignments ever, the COVID vaccine. Officials in protective gear take out the vaccine. It is then sanitized before celebrating the arrival of the vaccine. According to the Prime Minister's office, Dr. Lote said the gesture signifies the compassion and generosity of the Prime Minister of India, Narendra Modi, and the people of India. He said it comes despite enormous challenges India was facing due to the pandemic. The Indian ambassador to Bhutan, Ruchira Kamboj, handed over the vaccine, the Oxford AstraZeneca vaccine, manufactured by the Serum Institute of India.
We are very confident that we have more than adequate storage capacities. Almost 2-3 months ago, we have done assessment of the cold chain across the country, from the primary healthcare center till the National Referral Hospital. The vaccine will be stored in the MSPD store in Thimphu. And then once we get the second batch, then we will start distributing to the health facilities.
Meanwhile, India has assured to cover the 2 doses. The country expects to vaccinate more than 500,000 people in mid-March. The government will vaccinate only when it receives enough doses to vaccinate all at once.
School joren patient ma jaga shu ma gekapna jogo beba referral gidonle ani dusu ludinga jegi shapto phidra deung se shuni ani bumchi da tongthang ngap chudinale te dida chiga bumchi da tongthang ngap chunale nga jegi thushim lebe inkena ben pilot se te mi reni ni lutuk digi be tani gi lerim che digi se shuna.
The arrival of the vaccine not only gives hope to Bhutan, but also exemplify the good relationship between the two countries. For Namgyongchu Paro, Sringdandup, BBS News.
Many countries have started mass vaccination against COVID-19, and Bhutan is yet to receive the vaccine. But a Bhutanese family living in Utah in the United States received their first dose of the Pfizer vaccine on 26th December. The family of 3 are all health workers in different hospitals. And as health workers, they were eligible for the first dose of the vaccine. Karma Wangmo and her 2 children, a daughter and a son, received the vaccine last month. Karma is a phlebotomist who draws blood and collects samples. They are most probably the first Bhutanese to get the vaccine.
대아den시아 베들린디아나 베우진들 kungin가질 텍스트 담말라 대가 데베두 고데베두 세안이 담메스 슈니빌라 나라게 호텔에 베우진데 남세메니 사이드 에펙트가 제 마운스 슈니빌라 데 사이드 에펙트다 아치치 장슈치 잡질라 장슈치 잡벨라 아치주 지치다베 대아니 베베스 슈니빌라 다 마치나르디 줍티 데 백신 토미가 미 슈니빌 데나 유르메롱아 알루니 마라게 알루니 데 땡아치 마치 숨라멜라도.
More than 130,000 doses of the vaccines were given to the frontline healthcare workers starting last month in Utah. And anyone who gets vaccinated receives a COVID-19 vaccination record card. The family is now waiting for their second dose. The Pfizer vaccine is given in 2 doses, 3 weeks apart. Meanwhile, the Prime Minister Dr. Lotus Sring said His Majesty the King has commanded to vaccinate every Bhutanese, including those abroad. According to the Foreign Ministry's records, More than 12,000 Bhutanese are living in 72 countries as of last month.
te kade tata pengi sosobera kanaila mangil meba dubi mise gyakab nangkyuiru gyakab chikairu khab meba phyudochira jamada se kanai se shunibi tani boletin chiril henga yongle goden tab kutsabi sajisugi goden tabbe ngachiri dubi mise phelaba jumidisu te logdera tengara yachirtu shudola kutsabi sajisiga dewa tabna tiru twedigibe chamnigi kokobi yobachin tiru 명아들이 모시기 수렵에 나니 세카 펩지 세 주니빌라 다니에 제 투사게 지미고베세 디메마 계약합기 시주데 뛴디기베 리메베 동베베 톱세와친 캅딜로 도디기베 마차바 주마다 세 주니비 디기 소루 녜카 깨니즈메 짤리 메토메라.
According to health experts, the majority of people are still vulnerable to the virus. It is only the current restrictions that are preventing more people from getting infected. Having a vaccine is the only way out for now. The ongoing pandemic has killed more than 2 million people and infected over 90 million across the globe since last year. Sunampem for BBS News. The National Referral Hospital in Thimphu urges people to call before coming to the hospital as they start to see the outpatients. An outpatient is a person coming for treatment but does not stay in the hospital. More than 100 people came to see the doctors and overwhelmed the hospital.
Patients wait outside the hospital as they take turns to see the doctors. But it is a problem when the services are limited to prevent the spread of the virus.
In this, I would like to request public not to come to hospital for medicine refill, as we are providing the medicine. They need to call the number which we have provided, and the medicines will be dropped in the respective zones where the patients are staying. The other is for immunization and other minor ailments. People are requested to visit the satellite clinics which are situated within your zones.
The people should first call the hospital.
We have teleconsultation services whereby a patient can call up a specialist and consult with the specialist. And if medicine or drug is required, the doctor will prescribe and our pharmacy will drop the medicine to the respective zones from where the patient can pick up. There may be some patients who, after doing teleconsultation, will require to be examined by a doctor to diagnose the disease. So only these type of patients we expect them to visit the hospital and not all the other patients.
According to the hospital, people cannot consult a doctor of their choice as there is only one doctor in each department. The services are expected to become normal towards the end of this month only if there are no cases in the community. Giledim for BBS News.
The Wangdifoda Hospital will be temporarily used for cancer-related surgeries. According to the Health Minister, this is to provide uninterrupted essential medical services amid the lockdown in Thimphu.
A team of 13 officials, 16 specialists and 7 nurses and technicians reached Wangdifodang a few days ago. They are currently in quarantine for 7 days. They will probably start the surgeries in the coming week.
Operation di ongdilu chapnigi te chala du sukara digdigibe yu se shunila ta ani ongdilu jode khon surjana dugola nimdun de chi surjana du dele test chap dele ongdiju dele khon pha operation pha chap te phara du dele te dapta operation judu te da discharge be sashimle te logdi na chunse bani de disue japcho kara mache shungi phidigi yu se shunila.
The minister said the medical equipment that is not available at the hospital have been taken from Thimphu. Similar teams are now in different regional and district hospitals in Mongar, Gilifu, Phuentsholing, Samti and Tashigang.
Tatsage bom diranga chara niji COVID-19 digu te shuten du bete ngachara darimgi ataragi te soigi shapto digu thomi foga seigi tsage bom yula te ani tsage digi bete disengachi kecho dusu ngachara soigi kecho doctor dusu te lunchogi menka nale patang digi be yula.
All in all, 16 specialists in the field of surgery, gynecology, pediatric, orthopedics, ophthalmology, ENT, and anesthesia are stationed across the country. Kilidem for BBS News.
Life in 18 districts is almost back to normal. The lockdown restriction is eased further. The first phase of unlocking began on 6th of this month. But most districts have decided to heighten the surveillance. This means no pilgrimage or hot spring baths. Sports like football and archery, which attracts more number of players, have been put on hold as well. District task forces were given the authority to decide on the relaxation of activities. The nationwide lockdown happened from 23rd of last month.
The second phase of relaxations comes almost a month after the nationwide lockdown was first imposed. This means people can now travel to other districts, schools, institutions and offices can function at full capacity, and all businesses except for dryungs, karaokes and nightclubs can function. Here in Samtsi, taxis and public transport buses have been instructed to have a mandatory partition, transparent partition between the drivers and the passengers. In Phuentsholing, there is not much joy for the football lovers.
Though residents of Phuentsholing are happy with the relaxations of second national lockdown, football enthusiasts here feels that football should also be allowed to play like other non-contact sports. I'm here with Sange, who loves to play football so much. So Sange, currently for time being football is restricted here. So what are your views on it?
Thank you so much. This year we cannot play much due to the lockdown, and after lockdown we played only for the 2 weeks due to second lockdown. And in this situation, I think if we are allowed to play, it is a good exercise and good for health also. And whenever we go to the football ground or whenever we visit football ground, there is strictly protocol are followed. So I don't think so there is any problem. So I will be helpful. I will be thankful if we are allowed to play football.
Thank you, Sange. Meanwhile, the taxi drivers in Nganglam in Pema Gatsel are delighted to be back on the roads.
Hema dodel kakdam te go damba beodalu ta misiti sugi ta namsami chi hamago ta anbendigi ta anikapsulu dumra chita madeu thila ta ngachi lakhor deop chachap mashura dare semga ti du sechunila ta lakhor du ngachi gi ta hema gai imbera ngachi gi ta inkina bewachin da business sum chila memola ta lakhor du dero chongchami da te ge macheba ngachi lakhor deop chachap kara te ata gai imbera te lishumbi jo chungno gi rewa kedola.
The colleges in the 18 districts can now resume.
We have had to postpone our examination by almost 20 days. And now we're planning to conduct the semester end examination from 18th January 2021. We may not be in a position to allow the students to go for vacation. If we were to send the students, they will also have to undergo 7 days quarantine. Those students were going into the red zone. So that will put more pressure on the government.
According to the National COVID-19 Task Force, movement restrictions is relaxed even in the 6 yellow zones which are now free of COVID-19. In Hamozinka Drungkhak in Dagana, people leaving the 3 gyeogs in the Drungkhak have to undergo 7-day quarantine and antigen test before leaving the Drungkhak. The Drungkhak was marked yellow zone following the detection of 5 positive cases. However, all business entities and construction works in the Drungkhak will be allowed in self-contained mode. Construction works have also resumed in the 18 districts. New measures like monitoring students' health and carrying out random COVID-19 tests in schools have also been introduced. With additional information from district correspondent Sharab Doji, BBS News, Samtsi.
Amid the already upended business, another predicament confronts the owners of entertainment centers in Gallipothomde. Most of their building owners asked them to vacate. The notice comes after some of them failed to pay the rent for almost 8 months.
Today, due to the COVID-19 pandemic, the dryungs, karaoke and discotheques in the country remain closed. There is no business.
그 통수기디다 디스카운트 가네 마진 대로 같이 6 month 디지디 같이 콜로 half of jinila 디 다튼다 다트 헤드다 마퍼 지마스다 6 month 디지다 1,20,000 디지디 밸런스 보면서 대안 빈디다 통수기다 가스카닌 심톰 텐슬라들라 대 같이 심톰 톰 텐스데라 대 symptom din la da ni ma ki ru as juila ren ma ji ani ki be da chim da dimia kara ba bok juila da dimia da mi ji me da chala tengi sen da ka de ni dimi da chim bi jindagi ba asila
da to am chini to da ngachi da tensa ga chemi wa da jindagi da ni chim bi khala ba so si ti ani bi dongmil ti da tensa sa go chemi la ti imidinani da ani bindi sungidani damsha dmula dan bi da ngachi lokang ri tindi wila
tingai khol khongsuran jinda dislab lap chibala den chingslu da to lonia veva fe ani government gi ki du jumchira na nai den ngachi la asiki du jinda du si ta gop sina khongsu jinda du si lamme khongsu return na government na le me na wave of base la bi mathumi digi khongsu be mi sup jan jumchi ngachi lu lamme la jinda du si.
According to a landlord, he issued an eviction notice to one of his tenants who runs a karaoke to rent the space to an office. He already waived its rent for 8 months.
가르가들이 베로 다 노선 대땅 없지도 다리기 내시디 다 가게라 마십지 내시메 발라 다니메들로 로치 공가 로니 공가 가게라 미시베 아니메들로 같이 라한속이 총디 다 조모도 버진 야디기베 젠 소소치 손샤와지 미다가세 나 가들아 내시지밀라.
Another building owner adds that most tenants are also given discounts.
마팔라 다트르엽시다 다 붕니 드레 셰도 세트다 지자바 달랑아기 50% 파베비신나레 대당 지가 안에 베소이라 50%신나레 데다 동로 숨지 도메기 동로 짱아 다니 베소 데 체칭가 도메기 디아 마파티가 아니 베소베 대배달로 대체 맞출로 공기 대 아니 베달로 대다동 얘기 마기 당기 그득이 이미디티다 데다 데 모라라 데다 다 베미츠베 세타 다 침치치 렌세 다니베다 데모 텐주니 세 아니벨람 데베올든디기다 데다 아니디 차라기 님자라 뚜리디 최고들 폭대용 세데 가포미디 최고들 폭대용 세데 마기 자창압치 파브레야 디디 디 폭터 대용 다 임메생아 렌니비베디 다 다리 렌니베도라.
An official from the Bhutan Chamber of Commerce and Industry suggests the owners of entertainment centers look for other alternatives than a rent waiver.
다동아 저기 바르다 레스토랑로 호텔로 스미스 테 고치디 와들라 아니 조라 집에 콩라야 고치 주베 디날로 라렌 탑주와진 공기 초와디 디딜레 종 미소가 스미지 지 아니 통매 순이빈라 인지민지 까르게다 다양디 치명고라 바르디 콩라기 디수기 사홍나라 디신날레 프로토콜 딜리슈메 폴로베 베베와진 공기 고급 콩라기 초와디 아니 종 미소가 스미지.
Currently, there are 15 entertainment centers in Gilifuthromde. Most of them are karaoke. For Karmawadi in Sarpang, Cheku for BBS News.
The Election Commission is gearing up for the third Thomde elections in Gelifu, Phinsoling and Thimphu. The Commission is contacting one registered voter from each household and gathering certain details. And this, according to the Commission, is mainly to conduct the elections in line with the COVID-19 safety protocols. In light of the pandemic, the ECB wants to minimize crowds as far as possible during the elections.
당가치기나 토날루디 팀불루 아님 주유세 당가치기 뎀궁나 배워진 팀북이 속바 뎀궁 아니칼루 미 아님 주유세 토딩가치다 유일라 디부다 게라나 주디 여가 메가딩 가치기 미시베발라 아니 시니기 될루라 땡가치기 홀루 주춘 피도스.
Once the required information are ready, the Commission will prepare the voting arrangements accordingly.
같이 배숨집에 와진 팀북이 촘되게 뎀궁나 주미디수 땡가치기 다래 안에베 주춘 당신나 나미 다 팀북이 미디 코 되수디 바 분나가 좀치가 이세 안타시가 좀치가 이소지 아니 수잉같이 가장 레시나 같이 뎀통 속임 퓨니라 다 디수 팔레 나 오모고펠라 때 아니 탑 디토도 조디기 될루 때 나라 유미디수 배와진 때텔레 같이 가데 같이 소경 강미디 가데 거의 볼로 짜차베 미 가림지 나타부나부 뒤미두가 아니 같이 시고베 시바진 디나루 미 마수치 두마레스노 같이 같이 소경 강미디 디다 티디베 마음 조시나 민담에서면 같이 pun좀 베마고페.
The Thomde Sokdes of Gyalifu, Phinsoling and Thimphu will complete their 5-year term on the 26th of next month. And as per the Election Act, the new Thomde Sokde should be reconstituted within 90 days from the date of expiry of the current Thomde Sokde. Today there are around 10,000 voters in these 3 Thomdes. Meanwhile, the Samdup Jongkhar Thomde Sokde will complete its term in September this year. Sunampem for BBS News. The lockdown was long. It was hard. Now imagine how long and hard it must have been for Kinzang Dema, a class 12 student of Dechin Choling Higher Secondary School. She not only had to cope with the lockdown as we all did, she also had to struggle to provide for her family, including an aunt with special need and a 1-year-old child, as the little food ration she had slowly ran out. As our correspondent Swing Dundum reports, she did a fine job holding the family together till help came in the form of Kidu from His Majesty the King.
The second lockdown caught Kinzang off guard. Her father, the family's sole breadwinner, was stuck in Paro. She was left with her 2 younger siblings and an aunt with special needs and her 1-year-old daughter.
The lockdown the total kak the mabi hema apa papa rula chitin de give papa rula suila this zumbe id ma California kana yela California kana kidney disorder chi thope ani menchi be kana yela hamni mi bi shilu chinagi layok disuga rangaragi godin thappe beguni degi da ngare da to rangorandu ma do mula uptuchi bini degi de sengi no sumtando zumbe di ligi bi misbela ngare katule di
As days passed, the little they had was running out: oil, cheese and vegetables. And even when shops were allowed to open in her locality, it was meaningless. Kinzang did not have any money left.
Zatung disoya ani hemonomi disoya kara zojo dele da to nimchina to divusum yalishumbe zatsu masukchila delo thakor du ngare ai pa gelfumin kanai la demogi ani condition yala jani member look subja jodo se male jichinone la ta ngara phata ni subeta jogi sen dodel kadam digi be mahi dele dida be ma mangil kege sen ngara le nam At
a time when she should be preparing for her board exams, Kinzang faced one of the greatest challenges in her life.
Sem kalumu la sem kalu jide se utale mi ba la ga chi zumbiru sem se chi duge matsuba la peshatare aigi koli tsagina daru chimna lula satung malam be kangilda angara di malare kemindu da amchungi alu chungku yebe la da to alu lochi lamji rengla da alu gi tsagila da alu nawajin angagi ga de be tsuga se de zungi koli tsagila ndigila da jinde chimsna de sule joram beru tubela indere beru de da total kadam ne tin de gi be dewa matha patte go be ni
It was Kinzang's teachers who suggested she seek support from the Druk Gyalpo's Relief Kidu. Although Kinzang was aware of the Relief Kidu during the first lockdown, she refrained from getting help then because things were comparatively better.
Niti podi bleda gebi kiduna tachi ziju beta gorvese sem tachi digila and announced being toll free number this na call be la dele marigita to situation gi college phami gate bina college sutti dele ta madu gate birathni be college gar khasel be didela dengaragia ta khasel be juila dele yagi officer gi ngalu sundila da chigi registration di approve juiga mijuga di ngachigi after few minutes call no 병원에서 디지털 록다운 시순데라 딜레 karma chenga de chi jakal ko londe langalo da chilu kidu thopse da kidu biwajin ngare apagi min thoka jinni slaptela.
The Drukgyalpo's relief kidu reached the family's doorstep a day after the application was approved.
Kebi kido ti thopjimne ngaragi kangil marang chira se subji la tia dampa zathungi rik disu chapchur na jimle zathungi chagi dise mi de mangel thobi mi de chek mangel cheka ji aigi minju bini de no phata yin la de lakpar du de mangel cheka ji pa chimkira te matsumi tu chimkira disu te matsumi mi disu lo disu ya tappe de kangil disu halam chi dise subji la mewanga darin bu che cholu la ngara da rik devi misi lashe chilu kidu devi namilo ngachi kidu thomi misi gaaragi khatule ngagibe miwanga da rimbo chilu sengi dinera namya jewa phami gazu yes juni illa.
Kinzang is now back to preparing for her board exams, and being a meritorious student, she expects to perform better. Moreover, deep within, she rests assured that her life has taken a different trajectory. This is Ringdandup, BBS News.
Phosphate in the presence of an enzyme phosphohexoisomerase.
Strays in Bhutan are lucky. Elsewhere, stray dogs and cats are at risk of starvation during the COVID-19 crisis, but not here in the country. His Majesty's Secretariat is coordinating a stray dog feeding program.
A team of Desoups collects leftovers from a kitchen. This is where food for Desoups is prepared in Thimphu. But that is not enough. The team drives down to Lungtifu. Large containers of food await them. It is prepared by the army. The team follows strict health safety protocol to take the food. And the feeding frenzy begins. 5 teams of Desoups feed more than 300 dogs every day in the streets of Thimphu. Many of these dogs risk starvation, as those who usually feed them are unable to do due to the lockdown. At the same time, the economic impact has put pressure on many residents. The dogs were also fed during the first lockdown in August across the country. The pandemic has not only affected people, but also made it harder for stray dogs in the country. This is Ringdandup, BBS News.
That's all for this week. Thank you for joining us. Stay safe.